What is HTS? HTS is a HIV testing services. And HIV testing services have 5 C's. One is consent. It's our prime duty to take consent of the client, of any client, whosoever come to us for testing, then we have to take consent. It can be verbal or written. Then second is confidentiality. Whosoever come to us, it's our duty to maintain confidentiality. That person is sharing his private history with us, and we never have to disclose that with anyone else. Then third is counseling. In counseling, we have to do pre-test and post-test. Pre-test we do before testing and post-test after testing, when we give the test report to the person. What we do in pre-testing? Pre-testing, we just tell them about modes of transmission, what is the procedure of test, and about their history and their whatsoever problem that person have and why that person come to us. Everything is in counseling session. Then fourth is correct test result. It's a technician's part. It's technician's duty to that do the test procedure properly, and quality testing must be there. If someone have problem in one test, that counts technician's duty to confirm that test with 3 test procedures. We are not giving anyone's that positive report with only doing the one test. We do 3 tests with different kits. If all have same problem, all have that positive result, then we declare that person as a positive client. Then fifth is care, treatment and support. It's our duty to give care. Then we do counseling of that post-test counseling also, and if someone have this disease, then it's our duty to uh, uh, send them to another department for treatment. If the person have any need of care, treatment and support, then we do that things also. Support, we just attach that client with NGOs and that supportive groups. And if someone has some that psychological issues and all, we send that person to another department for their that treatment. And so on that way, and all patients whosoever come to us have this disease, then that person we have to send to ART department for antiretroviral therapy. So on that way, this care, treatment and support is needed a lot. So these 5 C's are the part of ICTC centers. It's integrated counseling and testing centers all over India, and we try to give best services in these centers, and everyone can come to any center for testing. Or everywhere this test is free. And before some time the center's name was VCTC, Voluntary Counseling and Testing Center, but now these centers are ICTCs. It's integrated counseling, ICTC, it's integrated counseling and testing center, and where there are PPTCT also. I am working in a PPTCT. It's prevention of parent to child transmission. Every pregnant woman come to us for testing, and if someone have this problem, then we that start their treatment on time, so that any babies doesn't have this disease. Because if child have this disease in early stage, then it's for lifelong. So every pregnant lady have to do this HIV testing whenever she come to hospital on first visit. So this awareness is very important, so I decided to share little bit. So that's all. Thank you very much. This is Rita signing out until we meet again.